This is hip external rotation. And if it's all the way up like this, it's likely the end range or the limit of motion for hip external rotation. And even if it's more down towards the floor like this is external rotation. Or if you're sitting with your legs outstretched and your foot goes out to the side, with sitting or with driving, for example, that's rotating the hip out. And I point this out because so many people spend a lot of time both sitting and even walking with their hips externally rotated. When someone's walking with their hips in external rotation, that means that their feet are pointing out as they walk. And external rotation is not bad, but what I want people to understand is that it could be affecting the hip. If a joint's in a sustained position or does repetitive movements in one direction a lot, it may change the mobility in other planes. You might have a lot of hip external rotation, but you might lose hip internal rotation, or you might lose hip extension. And this idea is not what many orthopedic clinicians are thinking, but I find that lifestyle can really affect how your musculoskeletal system works, of course. For me, I know I have great external rotation, and I know that my hip internal rotation is also within the normal limits of 30 to 40 degrees, but because I spend a lot of time in external rotation when I'm sitting, every once in a while, I'll put my leg up here and get some internal rotation of my hip. And there are other ways to do it, but for me, this is just a convenient way to kind of balance my hip motions. I do not have hip pain, but I understand that I don't want to lose hip internal rotation, especially if I'm sitting in external rotation for hours a day. So for any hip disorder or non-hip disorder of the orthopedic musculoskeletal system, we must consider what forces, what positions, what movements your body is undergoing on a regular basis, because they can be contributory. So when I'm taking a verbal history, when I'm asking the patient about their lifestyle, I'm trying to deduce if there's something in the way they're sitting or sleeping or walking or lifting that is contributing to the orthopedic problem at hand. And if it is, we don't necessarily need to take external rotation of the hip away from someone's sitting position, for example, but we may need to just add a little bit more internal rotation into that person's life. So consider that some orthopedic disorders, in my experience, it's most, are problems of joints not moving well. And then secondly, consider if a joint's not moving well, is there something you're doing in your life that's causing that to happen? Unless there was trauma to the joint that the person can remember, it's likely something in the lifestyle that's contributing.